Would you do something that's a little bit of a challenge for 5 minutes a day for 23 days if you could get decreases in pain and inflammation, increased metabolism so you burn fat more efficiently, and positive effects on psychological health? Well, those are just a few of the benefits that scientific research shows you will get if you spend just 5 minutes a day engaging in cold therapy involving cold showers or cold plunges. And today, I'll highlight the ideal temperature and duration and explain these and more scientifically proven benefits you can expect. We'll include information on the best time to engage in the cold therapy if you're trying to build muscle as compared to those athletes who are engaging in endurance exercises, because the recommendations for those two cohorts are completely different. Research shows that the ideal temperature for a cold plunge or cold shower for most people is around 50 to 60 degrees Fahrenheit, which is 10 to 15 degrees Celsius. But even at the top of this temperature range, you'll need to acclimate yourself. So go slowly, aiming to get within that range within a week or so of starting the 23 days. The goal is at first to expose yourself to a mild amount of stress, and then in turn, your body's going to respond by increasing natural antioxidants and natural hormones that'll result in those health benefits. And the good thing is that with repeated exposure, this becomes a lot easier. When starting your 23 days of cold exposure, initially aim for a duration of at least 1 minute. Over the next week, gradually increase the length of exposure to 5 to 10 minutes. And at this point, you may be thinking, well, is there a practical way to determine if the water is cold enough or to determine how long I should stay in? Well, as a general rule of thumb, the temperature should be cold enough where you experience that big sigh or involuntary gasp, and some people even scream. That's known as the cold shock response. And it's time to get out of the water a few minutes after you've begun to shiver. And this means that you may need to challenge yourself with colder water as you acclimate yourself over time. You may be thinking, is there another way to get these same benefits? There is a thing called cryotherapy, which is another form of cold therapy, except that it uses specialized cryotherapy chambers. But the problem is, in order to be effective, the temperatures need to be negative 110 degrees Celsius or negative 166 degrees Fahrenheit for 2 to 4 minutes. So you're not going to get that same benefit from going out into a really cold winter's day. So how is it that cold therapy exerts its physiological benefits? Most of the benefits of cold therapy come from the release of noradrenaline, which is also called norepinephrine. And other hormones such as dopamine are involved as well, and messenger molecules of the immune system are involved, and also some of the effects come from upregulation of some of our cells. And because of these effects, research has shown that cold therapy decreases inflammation both in people with inflammatory conditions like rheumatoid arthritis, but also in athletes after their workouts. Interestingly, the recommendations for cold therapy differs according to the athlete's workout. For instance, in marathon runners and in tennis players, studies have actually found that cold therapy immediately after the competition decreased the inflammation and resulted in a quicker recovery. Conversely, cold therapy immediately after a workout aimed for muscle growth resulted in less muscle growth than in the control group that did not receive the cold therapy. And that's probably because of the fact that the inflammation after the workout is important in signaling for muscle growth. For this reason, if you're seeking muscle growth, you should not take the plunge for about 2 hours after your workout. Another benefit of cold therapy is that it has been shown to reduce certain types of pain. And we've got a natural analgesic system in our body. It's a natural pain relieving system that depends on a number of chemicals. And some of those chemicals are the natural opioids and others are noradrenaline. And both of those modulate pain, so they decrease the transmission of impulses that signal up to the brain. And both of those natural analgesics are increased with cold therapy. Another thing that happens with cold therapy is that there's an increased number of mitochondria in the cells. Mitochondria are considered the powerhouse of the cells because they're the organelles that produce energy. This means that you have the potential to benefit a diet plan focusing on losing weight. Don't get me wrong, cold therapy has not yet been proven to, by itself, result in weight loss, except in a couple studies that took the therapy to the extreme, which you don't want to do, at least in the first instance. But cold therapy can be a valuable addition to a diet and exercise plan, especially since cold therapy results in a greater amount of what we call brown fat. Now, brown fat improves metabolism by burning calories. And just as interesting, an increase in the number of brown fat cells that are in the body has been found to be protective in cardiovascular disease, diabetes, and other cardiometabolic disorders. And finally, with respect to the physical effects of cold therapy, there is emerging evidence that cold therapy results in an increased immunity as it increases certain types of white blood cells. And it also results in improvements in skin health because it tightens pores, reduces puffiness, and enhances blood circulation. With respect to cold therapy on psychological health, there is anecdotal evidence that it may help with depression and anxiety disorders, although there are no clinical trials that support that claim at this point. One of the things that I noticed when researching cold therapy was that many authors claim that it improves motivation, dedication, willpower, and resilience, which are all important in contributing to achieving goals and overcoming challenges. And I cannot actually point to any studies that prove that, but after engaging in cold plunges for 23 days, I really related to that claim. And interestingly, I also started to look forward to my daily plunge and the stimulating effects that I'd get for about 2 hours afterwards. So for the next 23 days, your goal is to engage in a mild stress that's aimed at stimulating production of protective molecules in your body that have many physical health benefits. But just as importantly, embracing the cold may be able to give you psychological benefits. So take note of those and actually post them in the comments below. As you're engaging in cold therapy, remember that just because something is good for you, more of that thing isn't necessarily better for you. Make sure that you acclimate yourself and also make sure that you get the okay from your physician before attempting cold therapy. And if you want to learn about other tips that are scientifically proven to improve your health, make sure that you like and subscribe. The videos in this channel are aimed at directly improving your health in 23 days and helping you develop healthy habits that you can embrace for much longer. See you in the next one.